Hello, everybody. Have a great evening. And today we have chosen a topic for the live discussion as surgical aortic valve replacement versus a transcutaneous aortic valve replacement. Now, this is a burning topic in our medical field right now, mainly because, like for heart surgery, there is the bypass surgery and there is a stenting. Similarly, now for aortic valve replacement, which is the main valve of the left ventricle, which is the main valve through which all the blood goes into the circulation, uh, can be replaced without having to perform a surgery. So, like a stent is placed inside the blood vessels of the heart, same way we can now implant a heart in aortic valve position without giving a scar. It's also famous as a scarless aortic valve implantation. So the terminology which is used for this is a transcutaneous aortic valve implantation. The word you have to understand is that if my valve is diseased, in that diseased valve itself, I put in a wire loaded with a valve, and that valve, after going inside that area, I expand there. And while the original valve is still there, it displaces the original valve, and inside that, we implant a new valve. So it's a transcutaneous aortic valve implantation. This is the most exciting field of cardiac sciences right now. We all are very excited, and we have started doing such procedures very regularly in India also. Worldwide, it has taken a lead also. And it is because it is so exciting, there are always the pros and cons with that, which I would like to discuss in this topic. So, before getting more into it, I'll just get you a brief, short video of what is considered as transcutaneous aortic valve. And I'll just share the screen for that purpose. I'll just share my screen with you so that you can see the video. So, this is how it's done. That heart which keeps beating regularly, in that beating heart, when the valve is narrow, what we do now to implant a valve inside, we bring a wire, and on the top of that wire, a valve is loaded, which is in a folded situation. So in a folded situation, the valve is brought there, just like any coronary stent. And once you reach the right spot, you verify it with so many different angles. This is the loaded valve which is being brought in that position. You verify it by multiple modalities, whether it is in right position, wrong position, where else. Dilate the whole surface so that the valve, whatever calcium is there, it gets fractured literally. And then a valve is loaded in and that is opened up inside. So this process of implanting a valve like this is called as transcutaneous aortic valve implantation. With this, we can change the valve without giving any scar on the patient's body. It's just through a groin blood vessel that the valve is taken in, and once open inside, it functions as a normal heart valve. It's a very exciting field in the science currently. And if we know the pros and cons of this very well, it's an excellent tool in our hands at the moment, though slightly expensive as of now because it's a new technology and the cost difference is very significant between a surgical aortic valve and a percutaneous valve. Yet, this is likely to replace a lot of surgeries in future, and that's why we all feel very excited about it. So this is the surgical part I'll explain. And now this is the percutaneous valve. I'll similarly show you what we do in the surgery nowadays. So for the surgery, actually a scar, which is something like 5 centimeter, 6 centimeter scar, through that scar again, on a beating heart nowadays, we do the valve implantation. This video is to educate you on that purpose. So you have seen both the sides and then you can make a decision, knowing well the pros and cons. Today's live talk is primarily to educate you more about both these technologies. So this is the heart. In a traditional way, we arrest the heart. When the heart is arrested, after that, you can see the view inside. Now, this is a real heart being shown to you. In this, we actually remove the existing valve by cutting it across. And that valve, when it is cut fully, after cutting the valve fully, we take stitches and with those stitches, we implant a fresh valve. So this is the difference between the two technologies, a transcutaneous aortic valve implantation versus a surgical aortic valve replacement. So instead of implantation, here the word is replacement. Here the surgical valve has been removed, the original valve has been removed. Now the sizing is being done. It is really physically being done by the surgeon himself. There is no graphics, there is no thing. So now there are no graphics for this sort of a procedure because there is no company benefiting out of this directly. Usually animations and graphics are made by the company. So you have to bear with the surgical video that I'm showing you right now. As you see now, precise sutures are being taken. Those sutures, once we take circumferentially, we put these sutures back onto the valve also, and such a valve is then implanted back inside. Now, when we release the valve there, the valve is inside, it functions fully. And once the valve is implanted in, after that, oh, I'm so sorry, the screen is not showing in this. So I'm told that the screen was not being shared to with you. So I'll just show you briefly once more how we do it. So in the surgery, this is the way we do it. We make a small incision nearly 5 centimeters. We reach the heart. After reaching the heart, we open the aorta. It is done live, but it is fully well controlled. There is no animation or graphics to show you here this, but this is the way we remove the valve. After removing the valve completely, we start taking stitches. These stitches are taken in that position to secure the valve in the correct plane. And once all the stitches are taken, this valve is being implanted inside. This is a surgical valve replacement being done. The technology here is surgical valve replacement. And at the end of the procedure, you can see the valve is sitting inside. We close the aorta and the procedure is done. So this is the valve being shown by the camera there. There are no graphics in this because the graphics really is very high end animation. Usually it's not shown. Now I will show you the video of. So this is the way a valve is implanted by percutaneous method, that is the TAVI. In this method, what we do essentially is take a wire inside the heart, and when the wire is reached the correct place, we load a balloon on top of it. When that balloon is inflated there, this cracks open the valve. Though the valve remains in that position itself, we are not removing the valve. So the procedure is called as transcutaneous aortic valve implantation. And the fresh valve is put there and it is opened up there. So in by this technique, there is no scar on the patient's body and everything is being done through a groin blood vessel. So this is the essential technologies which I would like to share with you. And now once we know about the technology, we can discuss more about the pros and cons of each. Both are excellent ways of doing the surgery and both actually prolong lives. So I'll just stop the screen sharing with you right now. Now I'll just speak to you directly. Now we have to know the thing, why these are the two separate technologies and why the confusion between them. Simple thing is, like a stent is being done by the cardiologist, TAVR or the TAVI as a procedure is being done largely by the cardiologist, though nowadays we surgeons have also started doing it. But both the technologies have certain positives and negatives. Traditionally, all the aortic valve replacements were done by surgical means, and we used to give a full incision, which would be around nearly 25 centimeter incision in the front of the chest. We split the bone, and after splitting the bone, we arrest the heart, we stop the heart, we open the heart, and inside we would replace the valve by taking stitches there. That was the normal way of doing it. Then through the surgical advances, nowadays we do the same thing with a small incision, which is around 5 to 6 centimeters. And through with this incision, we are able to do the whole surgery. TAVI has come as a parallel innovation. In this, the same valve which we put in the tissue valve, which we put in the position, it's folded in and put in. And that valve can remain there implanted and works very well and beautifully. In the surgical valve, we have choices of valve that you can put. The traditional surgical valve or a minimally invasive surgical valve is of two types. One is a mechanical valve, one is a tissue valve. A mechanical valve can stay in your body for lifelong as long as it is not getting a blood clot inside. So once implanted well, and if it is not being infected, these are the two caveats that we all have to remember. If it is not being infected, a mechanical valve, if you keep anticoagulation correctly, over next 10 years, 20 years can stay very, very long and durable because its physical durability is good. And for the same reason, anybody below 60 years of age, we recommend a mechanical heart valve. This mechanical heart valve, if in India, largely the aortic valve disease continues to be through a rheumatic disease, which happens in younger age group of people. It's an excellent tool for them, a mechanical surgical valve, which nowadays we do through a small incision. When we go beyond 60 years of age and we start comparing what is the best option for the patient, in that case, tissue valve becomes a very good option for the patient. The tissue valves can be folded, and because they can be folded, they are the ones which we use for a TAVI. We fold the valve, put it onto a catheter, and take it inside and implant it there. So a folded tissue valve is the hallmark or is the cutting edge technology right now. Only limitation is we usually do it above 60 years of age and preferably above 70 years of age. The logic for that is the tissue valves usually is the animal tissue obtained from a calf or a swine. So when you obtain a heart valve from a calf or a swine, it is not like natural body tissue belonging to us. So once we implant it inside, over time, over a few years, usually 15 to 20 years, that valve itself gets diseased. Our body reacts to it and causes calcification. A lot of new innovations have happened to increase the life of this sort of a valve. So first generation tissue valves, when they came in say 80s and 70s, were lasting few years, 3 to 5 years only. The second generation tissue valves, when they came in say early 90s, they started lasting for 10 years. Third generation tissue valves came around 2000. They are lasting nearly 20 years generally, and they are the state of art valves. Now, fourth generation sutureless valves also have started coming, and these valves are promising a life of 20 plus years. So 25, 30 years also they are promising, but that we don't know as yet because it has not stood the test of time. So if I implant a valve today, whether it will last 25 years, it will last 25 years or not, that only time will tell. So the valves which were launched in 2000, we can vouch up to those valves, Paramount Magna and similar valves. They do last up to 20 years in certain group of patients. But on an average, most of the valves tend to fail between 15 to 20 years of age, the tissue valves. Same way, percutaneous valves, this TAVI valve technology has come recently, and over last 5 years only its use has expanded. In fact, in Europe now, because most of the patients who get aortic valve surgery done belong to the age group of more than 60 years, nowadays more TAVI is being done than a SAVI. So a surgical valve implantation or surgical valve replacement is being done less often than a percutaneous valve implantation because the age group is like that and because the cost implications are very less for them. Unfortunately, for India, there are two problems. One, in India, most of the patients want only one procedure. And when you give them a valve saying that this may fail at the end of 5 to 10 years, which is usually the case with the current generation TAVI valves. These current generation TAVI valves are designated for 5 to 10 years. Beyond 10 years, there are no studies, no assurances. In fact, sometimes below 5 years also it may fail. So they are in that way equivalent to a second generation or first generation of surgical valves that came into the market. Now, when you implant such a valve and patient understands well that it may last only for 5 to 10 years, the patient has to be mentally prepared for another procedure after 5 to 10 years. That unfortunately does not happen in India. most of the Indians want कि surgery की है आपने तो एक ही बार हो, दूसरी बार मुझे surgery नहीं करवानी है. For that use, TAVI is yet to mature. In few years, we might start getting valves which last for 20 years for sure also. Or maybe the current generation valve itself will start lasting that long, but that only time will tell. Right now, there are only animal studies and parallel studies which are heavily industry sponsored. So now, say I compare two valves from the same company, like Edwards is an excellent American company. We have been using Edwards surgical valves for last 30, 40 years. They are excellent valves. The current generation Edwards valve lasts in most of the patients around 20 years plus. For the same aortic valve implantation, when they sell a valve, it is something like 2 lakh rupees, 2.25 or 2.5 lakh rupees. There are two models separately. And the cost of that valve is around 2.5 lakhs. For the TAVI, the same similar valve which they provide along with all its paraphernalia, catheters and all, the cost of the valve itself reaches in the range of 21 lakhs. So same company selling two different types of valve. One is 21 lakh, one is 2.5 lakh. So inherently we are scared to take any data on its face value right now, because when the profit margin or the business margin is so high, any operator, any surgeon will be scared to really judiciously think about that data critically. The margin is expensive, margin is very high. So because of that, initially we are taking it with a pinch of salt. Currently, the dictum right now, what we are following is above 70 years, TAVI is recommended for everybody in India if you can pay that much amount. Currently, if 60 years and above comes, we first recommend as a minimally invasive aortic valve replacement as a first choice, because for 15 to 20 years it will work and most probably it will be the single operation in your life. There are certain Indian valves which have been launched only last year, and these valves also again very promising valves. Merrill as a company has brought in this valve, and I'll specifically talk about it. These valves are very handy, very easy, and they have brought down the cost significantly. So similar valve which international company was selling for 21 lakhs, Indian company has started selling it for something like 11, 12 lakhs. Or nowadays, if you put it up to a 15 lakh, whole package can be completed. But then that sort of a package also comes with that caveat. Right now, we don't know that the life of that valve will be more than 10, 15 years or not. So above 70 years, we are comfortable recommending it, because when we do a surgery for aortic valve at 70 years, chances that this gentleman will require another surgery would come only after 75 to 77 years of age. And that is very comfortable zone. This durability of valve is the only sore point for TAVI. Once the durability part is taken care of, everybody will be doing this sort of a valve only instead of doing the whole surgical valve. Because everybody wants to avoid a scar. I want to scar the avoid for the patient as much as possible. And that's why instead of doing a full aortic valve replacement, nowadays we do the aortic valve replacement through this much valve. So these are the technical aspects of the valve surgery. I hope I have given a brief explanation for it all to everybody. For further communication, for further questions, for further clarifications, now we can have the question and answers here. So I'll take the questions as they appear. Okay, what is the life expectancy after aortic valve replacement? That is a question coming from Ms. Fatima. So, see, aortic valve replacement is something, if you do it at appropriate age, when the heart has not gotten damaged, potentially life expectancy can be near normal. A person after getting aortic valve replacement can live a near normal life. What happens effectively is, in practice, most of the people are not able to manage their INR. So if I change a valve for a 20-year-old person, so as I briefly explained to you, a mechanical valve will be ideal for that individual. And once you put in a mechanical valve, the durability of the valve is not questioned. Generally, valves of the current generation are durable. They can last 50, 60 years also. Only problem comes is around that valve, there is a Panis formation which can form and block the valve physically. That happens in something like 2 or 3 patients in every 10 years. Further, it can happen is the valve develops a blood clot inside. For that, we give blood thinners lifelong. And if that person is taking blood thinners lifelong, chances of that blockage because of clot happening is every 10 years 2 to 3% again. So we lose patients because not of the durability of the valve or the heart becomes weak generally. Generally, we lose it because the Panis formation or the clot formation blocks the valve and causes the problem. For the tissue valves, you are putting a valve in a patient who has had a very long course of illnesses where the heart has become sicker. Age is already beyond 60. So then after a valve implantation, general life expectancy would be in the range of 10 to 15 years. Very few patients beyond that live till 30, 40 years, but it does happen. So like Arnold Schwarzenegger is a glaring example. He's a film star, you know very well. He got a tissue valve surgically implanted initially, and very recently he got now after 20 years that valve had got completely damaged, the tissue valve, and he has got it replaced by a TAVI. So this is a fusion of two technologies in the same patient, which is a very famous example right now. He's living very happily so far. What are the symptoms of bad aortic heart valve? That's the question coming from Ms. Rain. So, any aortic valve disease will manifest in few ways. One is chest pain. So, chest pain is actually essentially similar to a chest pain caused by the heart attack. Similar to that, chest pain comes because of aortic valve disease if it is stenosed. If stenosed valve is not taken care of, or if it is a leaking valve, then heart keeps enlarging, and that enlarged heart may manifest as the signs of heart failure, like increased beating of the heart. Every heartbeat is being felt. Breathlessness, which occurs even after walking small distance or climbing a few flight of stairs. So breathlessness, chest pain, and palpitations. These are the three features with which aortic valve disease will manifest. What are the risks of heart valve replacement surgery is next question coming in. So heart valve replacement surgery, the risks are very few, far and few. Nowadays, we do it with the 99.5% kind of a survival rate after the surgery at the end of 3 months, and excellent record after that also. So heart valve surgery mortality is very low if you are a low risk patient. So we do typically what is known as a Euroscore before doing the surgery. For people who otherwise don't have any other disease, the age is below 60 years, the risk of surgery is in the range of 0.5% only. If somebody is above 60 years of age, has diabetes, has obesity, has other problems like a failing heart, then the risk increases to something like 2 to 3%. Phone number is in the scroll right now. You can see the scroll and note my number, Mr. Vijay. So if there are any further questions, I'll continue with the conversation. I know initially because of technical glitch, we could not share the video properly, but I hope overall this stream works for you. Ms. Vidya, my phone number is 8800006735. Okay, with this, I'll end the session. Acha, there's one more question coming in. Does blood pressure increase after aortic valve replacement surgery? So, for a patient who has had a aortic stenosis for a long time, say if the aortic valve was narrow and a heart has been habitual of pumping with the narrow valve, the heart has learned actually the pressure inside the heart's valve, inside the heart is very high. Now, suddenly when you remove the valve, initially the BP will be very high till heart adjusts to the new reality, and then over time the blood pressure will come back to a normal level. So initially we may have to give medicines to lower the blood pressure or stabilize the blood pressure, but it's not a lifelong thing, and many patients who don't have any other hypertension otherwise, the medicines will be tapered off and taken away after 3 months generally. So with this, I'll finish my conversation today. Nice talking to you. Next time, I'll try to avoid this technical glitch. Thank you. Thank you very much.